name is Rosemarie. I'm a student nurse practitioner, and I'm going to be performing a full physical exam on you today. I'm going to be touching you throughout the exam, so if there's anything that you're uncomfortable with, please let me know. For the purpose of this exam, I'm only going to be doing one side of the body, just for time, and we're also not going to be removing any clothes. We're going to protect patient privacy. Normally, you would drape the patient appropriately, but for now, we're just going to keep everything on. So I've already washed my hands, so we're going to start. Can you tell me your full name and date of birth?
Rolla Hussein, 2/1894.
And today's date?
4/30/23.
And where are you right now?
In a doctor's office.
Right. So we are alert and oriented ×3. Speech is clear and appropriate. I'm going to give you 3 words. I want you to repeat them to me now, and then I'm going to ask for them again later.
Okay.
Lake, pen, table.
Lake, pen, table.
Okay. Now we're just going to do a quick eye test. So if you could just tell me the letters that I point to.
U, S, D, G.
Good. So we have 20/20 vision, and your cranial nerve 2 is intact. Can you repeat those 3 words to me again?
Lake, pen, table.
Good. Okay. So I'm going to start with your head. So I am going to just palpate your head. So the head skull is atraumatic, normocephalic. Any tenderness while I'm touching?
No.
No tenderness on the scalp, no lesions or scales. Hair is evenly distributed, no areas of baldness. Hair is fine to touch. Okay, clean up. I'm going to palpate your temporal arteries. Just tell me if you feel any tenderness.
No.
No. Okay, good. 2+. Eyebrows, eyelashes are symmetrical. Even hair distribution. Eyes are symmetrical. Irises are brown. Sclera is white. I'm just going to pull up on your eyelids to check the conjunctiva, which are pink in the upper and pink in the lower. Medial and lateral acanthuses are moist with no excessive tear production. I'm going to palpate your sinuses while I'm here, so just tell me if you feel any tenderness. Frontal?
No.
Maxillary?
No.
And can you smile for me? Raise your eyebrows. Good. So that is the facial, cranial nerve 7 is intact. And you feel me touching your face, right?
Yes. Mm-hmm.
So that's your trigeminal, which is also intact.
Mm-hmm.
I'm going to, I'm just going to palpate your nose as well. Any tenderness?
No.
No. And nose is symmetrical, no deviation. Ears are symmetrical. Okay, so next I'm going to look into your eyes, at your pupils. So we're going to do direct, which is where I just look directly into your eye, and they are equal, round, and reactive to light. And I'm going to check the consensual reflex. I'm going to look in one eye and then look in the other, and it does also constrict, which is good. While I'm here, I'm going to look into your eye, check for see if there's any ruptured retinal vessels, any macular degeneration, and your red light reflex. So I'm going to just put my hand up on your head so that I don't bump into you as I come in. And then come in from the corner and just try to find that red light and keep coming all the way in. I'm sorry, now it's super close. And there it is. But no scratches either on the cornea. Okay, so next we're going to test, I'm sorry, this is bright. Next we're going to test your ocular eye movements, which is cranial nerves 3, 4, and 6. So just look straight ahead at my finger, don't move your head. We're going to come forward and backward. Good, so convergence and accommodation are intact. Now we're just going to, again, continue to follow my finger. So there's no nystagmus noted there. Next we're going to, let's look in the nose for now. Okay, so if you could just point your head up. Sorry. Good, so it's pink and moist, no polyps, no deviation. I am going to have you just occlude one nostril and just tell me what you smell. Alcohol. Good. So that is cranial nerve 1 that is intact. Next we're going to look, so we're going to look at the lips. Lips are pink and moist, no cracking. I'm going to look inside your mouth. Open up. Buccal mucosa is pink, hard and soft palates are moist, under the tongue is blue. Can you stick out the tongue for me? Good, say ah. Tonsils are 1+. Can you just move your tongue side to side for me? Good. So that is cranial nerve 12, which is intact. I'm going to test your gag reflex. Sorry. Okay, we're good.
Yeah.
Good. That's cranial nerve 9 and 10 intact. All right, moving on to the ears. So I already said they were symmetrical. We're gonna, oh, you know what? First, I'm gonna have you just occlude that ear, and I'm gonna whisper some words. Just tell me what you hear.
1, 2, 3.
Good. Okay. Just stay sideways for me. I'm gonna look in your ear. No, you're fine. Can I take the whole piece off? So, oh, before I do, I'm just gonna pull on the pin and just tell me if you feel any pain.
Mm-mm.
No? Okay. We're gonna go, so we're gonna pull the pin up and back and insert the speculum downwards. The tympanic membrane you can see is pearly. There's no cerumen present. Good. And then the cone of light would be 5 on the right, 7 on the left. We're only checking one side for now. Okay, we're gonna do some other hearing tests to check for consensual and sensorineural hearing loss. So first I'm gonna just tap the tuning fork, place it on the center of your head, and you're just gonna tell me if you hear the vibration equally. Yes, okay. So next we're gonna check for conductive hearing loss. I'm gonna tap the tuning fork, place it on the bone behind your ear. You're gonna tell me when you stop hearing it, and then I'm gonna move it to the side of your ear, and you're gonna tell me again when you stop hearing it. It should be longer when it's in the air.
No.
Good. So we measure the time with the clock on the wall to make sure that that is all correct. Okay, so we're gonna keep going down. We're gonna do the neck. So neck is symmetrical, there's no masses, trachea is midline, no deviation. I'm gonna come around and palpate the trachea again. My hands are gonna come around your neck. So if you can, just take a swallow for me. Good, trachea moves up and down symmetrically. While I'm back here, I'm just gonna take a peek at the cervical spine. We're gonna palpate the spine, any tenderness?
No.
No masses. I'm just gonna come all the way down the spine and the spinal muscles. And just tell me if you feel any tenderness as I go down.
No.
Good, no masses found. Okay. Next I'm gonna do all of your lymph nodes. So we're gonna start with the occipital. Any tenderness? I don't feel anything. Just let me know if you feel any tenderness. Preauricular, postauricular, submandibular, submental. Then we have the cervical chain. You have 3 deep, superficial, and posterior. Those are usually a little bit more difficult to feel. And the supraclavicular. Next, let me think. Next we'll do, okay, so we'll inspect the chest. I'm not gonna have you take anything, I'm just gonna look under. So we're just looking at the skin, looking to make sure that there's no scars, no masses, nothing that's protruding. I'm gonna palpate for any masses, any tenderness. Anything? No? Good? Okay. Next we're gonna percuss the way down the chest. You're gonna percuss in between the ribs to make sure that everything sounds nice and tympanic. Okay, very good. Next we're gonna take a listen for 1 full breath. Normally you would go on the skin, but for now, just gonna. Okay. So we hear clear sounds throughout for the broncho and vesicular and bronchovesicular breath sounds. Where you can estimate that the AP diameter is 1 to 2, which is appropriate. I'm gonna come to the back and basically do the same thing all over again. We're gonna inspect the back, make sure that there's no masses, nothing protruding, no scars. We palpated the back before, but we'll do it one more time. I'm I'm gonna check for chest expansion, so I'm just gonna place my hands up around your back at the bottom of the rib cage. Ask you to take a deep breath in and back, and good. Your chest moves up and down symmetrically. We are going to percuss again. Sorry, pulling your hair. I apologize. Of course, the phone right now. Okay, and then while I'm percussing, we're gonna check for diaphragmatic excursion. So what I'm gonna have you do is take a deep breath in and hold it, and I'm gonna percuss down until I hit diaphragm. Find that end of your ribs here. Okay, let me know when you're ready to take a breath in. Okay, hold it. Okay, so this is a little dull. Sorry, I'm just gonna use your shirt as like a marker. All right, now when you're ready, take a deep breath out and hold it. So we're gonna say about here, and then you would measure. Normally it's anywhere from 3 to 5, could be 7 to 8 if you're well conditioned. I am going to assess for tactile fremitus. Place my hands along your back, and you're just going to say 99.
99. 99. 99. 99.
Good. So you feel the vibrations, which is good. It's no signs of consolidation, meaning no pneumonia. I'm going to place the stethoscope on your back. As I do, I just want you to say the letter E.
E. E. E. E. E. E. E. E. E. E.
Good. So no, doesn't turn to A, which is good. So no consolidation. I'm gonna have you just whisper the numbers 1, 2, 3 for me. Make sure that they stay muffled.
Okay. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2,
Good. So muffling is good. It means that there is no consolidation yet again. And now I'm just gonna ask you to take a deep breath as I go so we can listen for your breath sounds. Good. Nice and clear all the way throughout, which is perfect. Okay, we're gonna move on to the heart. So first we're just gonna acknowledge the four landmarks. So you have aortic, pulmonic, tricuspid, mitral, and the mitral is also where you have your apical impulse. Before you came, we did your blood pressure and pulse, and we checked for your pulse deficit, which there was none, which is great. I'm going to take a listen with both the diaphragm and the bell and the stethoscope to these heart sounds I just pointed out. I'm just gonna go underneath. Now we're gonna flip. I'm sorry. Good. So we hear S1 and S2 are present. I'm just going to ask you to lean forward and I'm going to come back in on that mitral sound. Good. Still no murmurs. Awesome. I'm going to have you just lay back for me. So we're going to look also at the carotid and the jugular. So I don't see any extra pulsations. I'm just going to palpate your carotid only on one side. Good. Feel that pulsating 2+, which is great. I'm going to listen to make sure there's no bruits heard at the carotid. All right, good. And then we're going to listen to all of the heart sounds again with both the diaphragm and the bell in all these positions. While I'm here, I'm also gonna auscultate all of your arteries that we have to make sure that there's no bruise here. So we're gonna start with your aortic, iliac, renal, femoral. No bruise or heard. While I'm here at the femoral, I'm just gonna palpate your inguinal nodes and then your femoral pulses. Okay. We're gonna move now to the abdomen. Normally I would pull up the shirt to inspect the skin, looking for any scars, any pulsations, any masses. We are going to auscultate the abdomen. We're going to start in the right lower quadrant. Just move along. You listen normally for 3 to 5 minutes if you don't hear anything. Just looking to see if there are any vowel sounds. Okay. Then we start with percussion. Same story. Nice tympanic sounds. We're going to percuss the liver and the spleen. So we're going to go here for the spleen, under the ribs over here. Nice and tympanic. So there's no signs of splenomegaly. And then the liver. You also just check for the liver borders. I'm going to start with light palpation. Let me know if you feel any tenderness. And we're just also checking to see if there's any masses. I'm going to go a little deeper. Any pain? No masses. I'm going to hook under just to see if I can feel the borders of the liver. Sorry, I'm going to go under your ribs. I apologize. Okay. Good. Okay, same thing for your spleen. Just going to go with my left hand right under. Okay, perfect. Okay. I think we're good there. Let's sit up one more time. I'm going to check for CVA tenderness, check on your kidneys. So I'm just going to place my hands right about where your ribs end, right where your kidneys would begin, and I'm just going to kind of do a little bang to your back. Just tell me if you feel any pain. Good. Okay, so no tenderness. Okay, so next we are going to do range of motion and muscle strength. So we're going to start with, actually, I never did TMJ, so we're just going to check for any clicking. Can you open your mouth? Good. No pain, right? Move your jaw side to side. No, you just your jaw. Awesome. Good. I'm going to place my hand on your face. Just try to turn against my hand. Good. Same thing on this side. Good. Can you turn your neck? Good. And just straight this way. Good. Extend and flex. Awesome. So muscle strength is 5 out of 5. You have all range of motion. Can you shrug your shoulders for me? Good. So that's cranial nerve 11 intact, and I'm just going to push up against my hands. Perfect. Shoulder muscle strength is 5 out of 5. I'm just going to feel for your rotator cuff and your bicep. Good. And I'm just going to palpate all the way down your extremities, just feeling all of your muscles. Okay, so we did shoulders, we did elbows, we did wrists, we did MCP, PIP, DIP. Very good. There's no evidence of cyanosis, no clubbing, no edema on the upper. We are going to continue with the range of motion. So let's go shoulders. I'm going to have you adduct, abduct, flex, extend, internal, and external. Awesome. I'm going to have you just bend and unbend to check the elbow. Good. And then the wrists, I'm just going to have you over. Good. And then just do a full circle. Awesome. So put your arms out for me forward. And well, first, let's see. Put your arms out, close your eyes, and just hold. We're going to hold for a few seconds to make sure that there's no drift. Awesome. I'm going to keep your arms up for me. I'm going to just pull you forward. Just try and resist. Awesome. Good. Muscle strength, 5 out of 5. let's do, so I palpated your hips already. There was no clicking or anything. So I'm just going to have you, if you can, one at a time, just bring your knee up to your chest. Awesome. The hip range of motion is good. Kick out this knee for me. Good. No pain in the knee, right? No, there's no crepitus. I'm going to come, again, palpating all the way down. Good. Can you flex your ankle up, down? Good. All right, awesome. And then on this, and then normally you go all the way down the toes, same thing as the fingers. So we would look again for cyanosis, clubbing, edema, which I don't see any. We got to do the muscle strength of the legs. So I'm just going to have you push up against my hands. Awesome. Okay, don't fall back. Good. We got to do pulses and deep tendon reflexes still. So let's start with the brachial. Can we get over? A little tight, I'm sorry. Whoa. Bruised. Okay. Alright, we did them. We're going to do posterior tib and dorsalis pes. Okay, everything is 2+ all the way down. Reflexes. Okay. So I'm gonna put my, sorry, I should have left that. I'm gonna put my thumb, I'm gonna have you flex. We're gonna try to find that tendon and then just relax a bit. Okay, we're just looking for the reflex here. Alright, we're gonna and just try to relax your arm. I'm gonna support your arm. We're gonna go right about here. Oh, I'm so sorry. At least I found it. Okay. That was your tricep. Now we're gonna do your brachioradialis. This one's a little bit more difficult. Looking for a little twitch in the fingers. I'm gonna hit you again one more time. Okay, good, awesome. Patellar. I know you don't really have one of these, but I want to be in view here. No, we know yours doesn't work. Okay. We're gonna do the Achilles down here. So just relax. Okay, and then I'm just gonna check the Mabinski here. So just relax your foot. Good. So you really shouldn't flex up too much. Awesome. Okay. We are going to. I'm gonna have you just close your eyes. We're gonna check for your sensations. We're gonna do the arms and legs, and I'm also gonna do just a little on the face. Okay. So you're gonna tell me if you feel sharp, dull, soft, whatever you feel, and you could also tell me where you feel it.
On my face, soft.
Good.
Sharp.
Okay, where was it?
On my right arm.
Okay, good.
Soft.
Good. Where?
Right leg.
Right leg. Okay, good. You can open your eyes. Oh, actually, no. Close them again. I'm going to place something in your hands, and I just want you to tell me what it is.
Condyle.
Awesome. Okay. We are going to do, let's see, one more sensation. Close your eyes. Just tell me what you feel. No, I stopped it.
Vibration.
Good. Okay, very good. All right, let's do some coordination. Can you, you're going to close your eyes and you're just going to bring your finger to your nose a few times. Good, very good, awesome, perfect. You can open your eyes. We did the pronator drift. Can you take your left heel and rub it up and down your right shin? Awesome, good, perfect. I'm going to have you stand up for me. We are going to just keep your eyes closed. I'm going to just put my arms out. We're just going to test your balance. Make sure arms down at your sides. I'm going to have my arms around you and just try and stand still. Okay, so normally you do this anywhere for 60 seconds, but you have good balance. I'm going to stand off to your side. You just walk heel to toe for me. Awesome. Can you walk on your heels back? Very good. On your toes forward. Awesome. We're gonna just check your range of motion of your spine because we didn't do that before. So if you could bend forward. Good. Come backward. Good. One side. Awesome. Other side. Very good. Range of motion of the spine is all intact. Your spine is straight. There's no curvature. Your posture is good. Okay. What am I forgetting? I don't know. Have a seat because I'm just think it out. 1 minute. We did. I feel like that's it. I think that's it. I think we're done. All right. I said you had 20/20 vision, right? I know we covered it. I don't remember if I said it out loud. Okay. I think that's it. Uh-oh. Swear to God.
It's there.